known Dr. David Page to use this table, and this is a conversion table. It's not a model, but it allows you to convert. If you have a risk factor and you know the power of that risk, it allows you to convert. A woman age 50 gets a atypical hyperplasia on a biopsy, gives her a relative risk of 4. It allows you to go backwards and say you've got an 18% chance of breast cancer in the next 20 years. And even though no one uses this because it's so old, I use it daily because it's kind of interesting to compare that to the Gale model and the Klaus model. One of the tricks of risk assessment is that I mentioned this earlier. The studies that gave us these numbers are studies usually less than 20-year follow-up. And so when we calculate a woman's risk, it is not linear, and yet the Gale model tends to be linear. If you're doing a 35-year-old and calculate to 90, you'll get some values up to 60, 70, 80%, but there's never been a study carried out that long to see if 60, 70% of the women really got breast cancer. And in fact, they probably don't. If you look at something like atypical hyperplasia, as the years go by and you don't get breast cancer, you're passing through your risk and it loses its power. The problem is we don't know at what rate it loses its power. But you pass through 20 years where the studies were done, and you start to creep back toward baseline. And so it's dangerous, and I was actually instructed by Dr. Page, the pathologist I was telling you about. I was instructed by him to really try to limit your assessments to 20 years or less because you're in dangerous water beyond there.